Hello everyone, I'm Dr. Lori Langdon, board certified pediatrician, mother of 6, grandmother to 2, with a quick update on vitamin K. The American Academy of Pediatrics felt strongly enough about this that they issued a new policy statement just last month, February of 2022. The reason they did is that we're seeing an increase in cases of late onset vitamin K deficiency bleeding. This disease used to be called hemorrhagic disease of the newborn. So I want for you to understand there are 3 phases when this can happen. Early onset, which is usually in the first 24 hours, and mostly in babies whose moms had to be on some sort of a vitamin K interfering medication during the pregnancy, such as anticonvulsants. And then the classic hemorrhagic disease of the newborn, or vitamin K deficiency bleeding, is from about 24 hours to 1 week. The late onset, VDKB, is from 1 week to 6 months, with a peak from 2 to 8 weeks. So the American Academy of Pediatrics recommends a 1 milligram dose intramuscular vitamin K given within 6 hours of birth. This is very important to prevent all the kinds of vitamin K deficiency bleeding. I think that sometimes parents can be swayed or confused when Instagram influencers or people like that present some concerns or false information about vitamin K. So we just want to make sure that you know this dose of vitamin K within 6 hours of life, 1 milligram for any baby greater than 1,500 grams at birth, is critical in preventing this dangerous disease. And I don't want you to be swayed by scare tactics out there by people who don't understand the evidence behind this recommendation. And I want for you to understand that we as pediatricians want what's best for your baby and want to help prevent this sometimes terrifying disease. It can cause not only cutaneous bleeding, lots of bruising, but more importantly, it can cause bleeding in the brain. And that's why it's so important that we administer this vitamin K within 6 hours of life so that we can prevent this trend of increasing cases. We are worried about newborns because they cannot manufacture as much vitamin K on their own because their gut flora is not there yet. They're sterile in their gut when they're first born. And even though human breast milk is absolutely the ideal nutrition for newborns, it does not contain a lot of vitamin K. For some reason, vitamin K just doesn't pass through the breast milk as well. So those infants at highest risk for late onset vitamin K deficiency bleeding are those who did not receive the vitamin K injection at birth and who are exclusively breastfed. So I hope that explains to you why the American Academy of Pediatrics is so excited about this, that they made a whole entire new policy based on the old one. And we've been doing this since 1961, and since then had seen a great decrease in these cases until more recently as an increasing number of people refuse that birth dose of vitamin K.